What if one idea could empower an entire community to save lives? It starts with us, and it starts at home. Hello, we are It Starts at Home.
My name is Ajigay, and I'm a Senegalese American.
And I am Ayusha Sapkota, and I'm a Nepali American. And we are
from
Louisville, Kentucky.
As a great man once said, give a man a fish, and you'll feed him for a day. Teach a man a fish, and you can feed him for a lifetime.
Similarly, our goal is to contribute to society by equipping individuals with essential skills to handle preventable medical issues effectively.
Before we continue, we would like to explain why this is our goal.
So we have categorized the problems in 3 different sections. One being natural disasters, the second one is sanitary problems, and the third one's distance. Born and raised in Nepal, I am acutely aware of circumstances dealt by the Nepali community. For example, the 2015 Gorkha earthquake. During this time, many thousands and millions of people lost their lives, and buildings were torn apart to pieces. This created sanitary problems and many health circumstances. This outrageous disaster caused changes to the environment as well, causing sanitary problems. This affected the clean water and fresh food supply system. Because of the lack of preparedness for disasters like such, it increased the risk of people's lives.
Senegal is a country that is especially vulnerable to natural disasters such as land erosion, droughts, and floods. However, the effect of these disasters could have been mitigated with just a bit of preparedness. One situation I can think of is when there was a lack of fire extinguishers and alarm systems in the vicinity during a natural disaster. Because of this, it had caused a lot more casualties than expected.
Because they're vulnerable to natural disasters and live such different lifestyles, they face sanitation issues.
In a country like Senegal, a lack of preparedness for sanitation can lead to an increase of outbreaks and epidemics.
One of the major problems faced by developing countries is the distance.
Because major hospitals and medical hubs are primarily located in cities, rural areas have a hard time getting to them.
An article by the World Health Organization has even stated that these countries have weak healthcare systems and are substantially strained by a lack of supplies, inadequate infrastructure, and limited health workforce, which hinders response efforts and the needed quality healthcare when faced with emergencies.
Solutions for problems like such is when It Starts at Home takes its place.
The phrase "It Starts at Home" encapsulates our approach. By fostering preparedness within communities, we aim to mitigate preventable health crises.
We are targeting SDG Goal 3 of ensuring healthy lives and promoting well-being for all at all ages.
An indicator of this would be to strengthen the capacity of all countries, in particular developing countries, for early warning, risk reduction, and management of national and global health risks.
In order to increase medical preparedness, we have 2 solutions. One is the distribution of medical supplies.
And the second is to increase medical knowledge in these communities.
Number 1, starting with distribution of medical supplies. With the help of donors, sponsors, and partnerships from EMT, hospitals, firefighting companies, and also collaborating with pharmacies to put in use of their surplus supplies, we plan to use every dollar to create medical supplies and medical kits to deliver directly to the ones in need. The medical kits that we intend to supply to the ones in need will include blood pressure kits, diabetes kits, ointments, cold and flu medicines, antibiotics, bandages, water filters, sunscreen, and etc.
We plan for our medical education programs to be supported by donations from individuals and businesses that are committed to helping spread health awareness. We aim to utilize donors like hospitals and local businesses and partner up with educational institutions and EMT foundations, and hopefully later on, global health organizations in order to fund and support the development of training materials. We are going to bring medical knowledge directly to underprivileged communities by organizing workshops in first aid, maternal health, disease prevention, and even emergency preparedness. We also plan to train local volunteers and educators to serve as health ambassadors in the communities. Additionally, we plan to create easy-to-understand material in local languages in order to make health education accessible to all. And lastly, we plan to create a hands-on curriculum in order to make learning engaging and effective. even for participants with limited formal education. We plan to utilize a method called volunteer-led training. This would mean relying on medical professionals, nurses, and medical practitioners who are willing to donate their time and expertise. We also plan to take advantage of simple, affordable tech tools. For example, preloaded tablets, which would mean distributing low-cost tablets with offline medical training guides and videos to regions with little internet availability. Additionally, we plan to utilize radio broadcasting, which would mean broadcasting tips and health resources through local radio stations, which would be more accessible to rural areas. Like most things, risks are included. One of the first risks that we may encounter is unpredictable funding. However, to combat this, we plan to diversify our funding sources in order to ensure stability. Funding can come anywhere from our grants, sponsorships, partnerships, donors, and even in-kind donations.
The second risk includes crossing cultural boundaries. For this risk, our solution is that we will listen to concerns from those specific countries, stay in their comfort zone, and try to help without crossing any cultural boundaries.
Another risk that we may encounter is geographical accessibility. To combat this though, even though these areas may be hard to reach, we plan to utilize local couriers, volunteers with motorbikes, and even community health workers who are familiar with the terrain in order to ensure that we are reaching these communities.
The fourth and final risk includes mismanagement and wastage of products. To prevent this, we plan to work closely with local communities, build partners, and even start volunteering options to ensure safe package delivery. Our ethics include 1. All steps and decisions should be based on our goal of helping our society. 2. Treating all with respect, dignity, and valuing diversity.
3. Honoring the privacy of our beneficiaries. And lastly, operating with good faith and honesty in all interactions, from fundraising to service delivery.
This is how we will implement It Starts at Home. Pre-implementation phase around 2024 will include securing funding, research community needs, and etc. During our implementation phase in 2026, we will launch programs and do community engagement programs and etc.
Our reconstruction phase will begin in late 2027, which will include refining program design, integrating technology, and expanding globally. Our sustainability phase will begin in 2028 and will include global partnerships and reducing direct involvement.
Remember, it starts at home.
Thank you for watching.